Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And I am at my office this weekend because I just finished attending an event that was put on by one of my mentors in the field of integrative oncology. His name's Dr. Neil McKinney. He's a naturopathic doctor out in British Columbia. Just a brilliant, brilliant guy. And I've had the privilege of learning from him on a number of occasions. And so, um, one of the things that he was talking about during the lecture was the interconnection between mitochondrial health and cancer cell pathophysiology. And it's a huge topic. There's so much that goes into cancer cell development, so many unknowns. But one of the things that I was inspired to make a video about after listening to him lecture for the last 3 hours was just the importance. It just really drove home for me the importance of looking at mitochondrial health. I, of course, talk about mitochondrial health when it comes to helping patients with complex chronic illness to recover from their maladies, their symptoms, especially helping folks to improve around symptoms around low energy and brain fog and things like that can help to promote faster tissue healing and just a myriad of benefits for folks dealing with complex chronic illness. But what it ultimately comes down to is that we really should all be paying attention to the health and integrity of our mitochondria, even when we're not suffering from complex chronic illness. When we look at the litany of conditions that can be that are associated with mitochondrial dysfunction, it's virtually every chronic health condition that you can name, and quite frankly, the main causes of mortality for our species, whether it's cardiovascular disease, diabetes, cancer. These things are all related to mitochondrial dysfunction. It plays a huge role. So just kind of trying to give a little bit of inspiration to folks, saying please make sure that you're taking care of your mitochondria. If you're not feeling fantastic, like hopefully you're listening to this, you're not chronically ill, but if you say, like my energy levels are a bit lower than where they should be, or my recovery when I'm exerting myself isn't as fast as it used to be, or I find that my mental, my focus, my memory, my random access memory, so to speak, to bring up details and facts and things like that, or memories on demand, if it's just not quite where it should be, those can all be potential clinical signs of your mitochondria not firing on all cylinders, so to speak. And so it's those little clues or those little warning signs to say, maybe my mitochondria need a little bit of extra TLC, and that's something worth talking to your clinician about. So I hope that information is useful.